with Anja, well, Anja will explain what she does, but our two sides come together really nicely with the birth and our experience with craniosacral therapy. So it kind of just fitted. And I think when we first started chatting about working together, it was because I was looking for someone to do the closing of the bone ceremony with me. And I'd been kind of looking for a doula to support me. And then I just had this aha moment when I was chatting with Anja that actually it could be really awesome to bring someone in who doesn't have a birth background but has a lot of cranial background. So that's how we started working together, offering that, and it's really beautiful ceremony that we've been doing. And then it kind of grew into working with babies together.
So you're offering closing of the bones together as a duo, as a therapy.
Yeah.
Nice.
So it's the wrapping and the closing, but then also with cranial, with one of us holding the cranium, one of us holding either the sacrum or the feet, because it's wonderful to have craniosacral with two or more practitioners holding. And then Anja is also a musician, so she brings crystal sound bowls, and we do some sound bowl work with the closing of the bones. So it's been really special. And then from that we kind of then I've always wanted to have a baby clinic, so I asked Anja to join me, and so the two of us are doing that. And we've had our first one a few weeks ago in Somerset West. It was really successful. It was really awesome. Just to create a space for moms to come and chat to each other, so network a little bit, but then also just get some exposure to cranial work and how it can be beneficial, and what they can do at home to support their babies as well.
Lovely. Well, that's
your side, Anja.
Well said, Amy. I actually don't know what to add. But listen, if my internet connection is unstable, just let me know, because I'm in a room where the kids cannot reach me, but that also means that the Wi-Fi is a bit up and down. But I can always relocate. But I think it's fine. You can hear me.
Yeah, it's fine. You're not, the connection seems absolutely fine. Yeah. And welcome, Sarah. So
okay.
Sarah.
So then,
sorry, I interrupted.
No, you can welcome, and then I can tell my part of the story. It's fine.
Yeah,
Karen.
I just want to welcome Sarah, because she is in Ireland. She's also a craniosacral therapist, and she's also here in the Due Date Club, and going to be offering a similar session at some stage, just to share her expertise. And so she was very interested to join tonight. So thank you, Sarah, for coming on.
Yeah, and I mean, it's just wonderful. I just tuned in a little bit there to Amy to hear, about the beginnings, but I'm also in awe of how this work, it needs to continue, doesn't it? I think some people think it's just for babies, and it seems to be tremendous, at other phases as well. And just to say, I may have to slip away because I'm packing my bags to see my daughter. So if I'm listening in, even if I need to turn the video off from time to time, not to distract people. Okay.
No worries. I think there's somebody else who might have joined. I heard a ping, but I'm not sure who else is here. Is anybody else?
Cara, is there?
It is I. Hello.
Hello. Hi, nice to see you.
Yeah, hi.
So Cara is one of the Due Date Club members. So we'll wait. I don't know who else said. While you're chatting, or may actually let's wait, Anja, for you to do your intro, because let's just see if someone else is coming. I just want to pop in and see if who else said they were going to join this evening. And Cara, you can maybe let us know how you've been.
Yeah, pretty good actually. Hey, I think I'm one of the lucky ones. I haven't had much of the drama symptoms and things like that. So shame, and it seems like it really does knock a lot of women. So I've been really grateful that I've been fine. Today is 30 weeks. I think I joined up to the due date. And with Charlene's hypnobirthing around, it must have been 8 weeks, 12 weeks. So it's been a nice journey to see and learn and meet everybody as well along the way. good. I think I'm a type of person that just needs a bit of prep before, so it like calms me down. But yeah, 30 weeks today. What is going well? She's lying sideways though, so I know I have till 34 weeks to get her the right way. So that'll be this month's project. But other than that, doing fine. Still gymming. Food.
Fantastic.
That's always a challenge, but fruit has always been a friend of mine the whole pregnancy, so that's good. Yeah, and husband's back for a bit as well. Leaves again at the end of middle of May, and then he'll be here for June and July. So yeah.
Okay, perfect.
Yeah.
And I think somebody else just popped on as well. I heard another beep. Anyone else there? I don't know why I can't seem to.
I can see Jacqueline here. Yeah.
Yeah.
Is it Jacqueline?
Jacqueline.
It's Jacqueline.
Hey, Jacqueline. Nice to see you. Hope you're well.
He's doing very well. Thank you. And yourself?
Good. Yeah, good. All good here. So it was just Jacqueline, Cara, and Sarah. I think that Kirsten might join a little bit later, but rather than waiting, if it is going to be recorded, I think we'll get going, Amy and Anja. And thank you so much, both of you, for joining to come to chat to us about craniosacral therapy and how it can help moms and babies in pregnancy and postpartum. I know, Anja, I interrupted you when you were about to share with us. So I don't know if you want to start, or if the two of you have got something prepared. I'm just going to kind of like put myself on mute and hand the floor over to you to chat to everybody. Okay.
Okay. Yeah, so in the name of craniosacral therapy, we are just going with the flow, I think, and just take everything that is in the group, and then we'll just roll with that. I just want to, because Amy has introduced herself, she comes from the birthing world as a doula, so she's very much in the beginning phase of baby's development, also nurturing the mother, and as you well know, and we've come together in a beautiful way through our studies, as Amy has told us before. But I come from a different direction. So I come from a neurodevelopment work. So I study craniosacral therapy basically to help my son, because he had various learning challenges. I come from the teaching world, music therapy, music. That was my realm until I birthed my first baby. And he basically showed me a world of alternative healing modalities. And it started with the reflexes. The reflexes are quite important in the first year of life. So I dove right into reflex work to help his brain recover and heal. And then, you dig deeper and deeper and want faster progress. So that's where I found fascial release. I'm super in love with the fascial system. I think it's the most beautiful. It holds consciousness, and it's such an intelligent fabric of life, and that we touch as craniosacral therapists as well. And especially babies are so still in that unconscious phase where the fascial system just unwinds and releases in a direction of ease. And I've got for Cara and maybe Jacqueline a picture here of the fascial system. If you don't know what it is, it's basically the web that surrounds everything in your body, from bones to organs, vessels, nerves, goes into every cell. It's simply beautiful. And because it's fluid filled, it moves. So I got into that, and Amy and I work very much with that, obviously, because that's what babies do. They just move into a direction of ease when they're held out of gravity. And then I discovered craniosacral therapy, because it's like another layer. And on the way of healing my child, I received so much healing work, and I just got hooked, and I had to study craniosacral therapy for myself. So that's the journey, and that's where I found Amy. And now, because I come from the neurodevelopment, so I saw for years and years a lot of children on the autism spectrum. So it's basically coming from another level altogether. It's not treating babies, it's treating kids that are just not functional, and healing those brains. So when we now work together, Amy can, nurture the beginning, and then I go into the reflexes and really teach the mothers the importance of tummy time and the leopard crawling and the 4-point on all fours, the one that we all know, but the leopard crawling, the army crawl, is just amazing for the brain development on a very deep level, which is so underestimated from the medical field. So that is then my part, to get the baby moving. So we basically, as craniosacral therapists, we check that the cranial bones and the pelvic bones are free to move, and the fascial system, and then we ignite the reflexes where need be and get the children crawling so that the brain can develop on its own, given the opportunity. So that is basically us in a nutshell. And we really want to get this going and empower parents so they are not stuck in a schooling system that doesn't work, with learning difficulties, etc., which we see more and more now. So if we can get the babies early on and assist families, it will be so much easier, because it can be quite a daunting space to be if you don't know where to go as a mom, and you feel that something is not right.
Absolutely.
So that's where we come from. So I don't know, Amy, if you want to add something to that. I can go on and on because I'm so passionate.
Well, what I wanted to add that you triggered was just how much information and education is needed, and that's why we decided to go the baby clinic route rather than just continue to treat one-on-one, which we do. We treat babies and children one-on-one in our practices, but there's so much space for education around just simple ways to interact and to hold and to handle our babies from newborn that can impact the fascial system as it develops and impact the reflexes that Anja was talking about. We've been so disconnected from the sort of natural ways that we hold, carry, and place our children in this modern world we live in that's full of contraptions and apparatus and bambos and bouncy chairs and car seats, and all of that really restricts the fascial system. Even swaddling is so restrictive for a fascial system, and we see these children who are babies that are so tight in their systems now because of those practices that have become so common in our modern world because they're convenient, and our society and our doesn't support new moms in the way that we should. We speak about this all the time in the birth world, about the revillaging that's needed and the support that's needed to allow moms to be everything that they need to be for their children. But instead we rely on these other containers and systems that really severely impact the development of the fascial system, and that impacts the development of the brain. So we kind of wanted to kind of group moms so that we could just educate and kind of give them permission to put their babies on their tummy and to let their baby's tummy sleep some of the time, or as much of the time as they're comfortable, and to not swaddle, and just give them different tools and different ways to interact and engage with their babies. So yeah, I don't know if there's any questions or anything that's...
It's so well said, Amy. Yeah, Karen?
Yeah, I thank you so much for sharing that, because I think it's such an important point that you bring, that so many of the things that are available for babies are more for convenience, and we don't recognize the impact it has on their growth and development and on their normal behavior and reflexes. The fact that babies or so much of their behavior is normal, but for a new mom who hasn't had a baby before, who's her first baby, she doesn't know what's normal and what's not, how she needs to do that. And I think it can be very confusing and very overwhelming when you are offered the bumbo and the car seat and the swaddling, and then you're told that it impacts. So maybe you can talk into that a little bit, because I agree with you, but then how do we use those wisely? Because they can still be used, but how do we use them? And what can you do in addition to that? So one, you understand what's normal for babies, and two, you can counteract the effects of the containing. So of bringing them in as opposed to allowing them to open up and spread and move.
For sure. Anja, do you want to feedback or?
Oh, okay. I can, and you just fill in what you think I've missed. So I think we need to use both. I think the word containment is also very important. All right. So it's not about letting a child just be on the floor, but a child also needs containment if a child is aroused and we take the child in. Very important to go from an aroused state into parasympathetic, So that's where we contain, definitely. But most of the time, a baby needs to be on the floor. And the most expensive equipment you can have for your child is the floor finished cloth. And I can say that with utmost urgency, that putting your baby on the tummy from day one, a baby will then get used to this lying on the tummy, lift the head slowly, get used to this position very comfortably. They lie in a specific reflex that actually soothes them. And then they start to kickstart and do the leopard crawling. From birth to 2 weeks, it can be already done. So that organizes the lowest part of the brain. If we put the baby on the back, it's basically a position of helplessness. There's no organization happening. That's just the bottom line. But if we put the baby on the tummy from day one and let them sleep on a safe mattress, I believe that's what I would do now with my children, most definitely. And obviously in car seats, we need to put our children in car seats for safety. We're not talking against that. But, I see children put in car seats, then they come home, they have their bumbos where they sit. They're not even ready to sit, but they're propped up and their muscles are not ready to sit in a bumbo. So a baby should be on the tummy, on a comfortable floor, really, all the time. And the people that I've trained with who do neurodevelopment, they also say at night a baby on the mat will actually leopard crawl during the night and do neurodevelopmental organization, which is just amazing. So that is my part. I'm a little bit
Yeah, and you're going to say she's a little bit regimented with that. She's very clear on that. Whereas I and this is where I deal with moms with newborns on a day-to-day basis, and I know that we have to allow space for a little bit of, at times certain things are necessary. And for me, what I see dealing with moms is that so often they just need permission and they just need an explanation, So I have a client who had her baby last week on Wednesday, her second son, and it was a beautiful healing home birth after quite a traumatic hospital experience the first time 5 years ago, and visiting her at home the day after the birth and just talking to her because she was really concerned about, colic and reflux because her first son struggled, and we just spoke a little bit about things that could be done. And one of the things that I said to her was just to let him sleep on his tummy, not necessarily all night if she's concerned about that, but if she's fed him and he's sleeping and she's going to get up to get changed or have a shower, just put him down safely on the safe mattress next to her on his tummy while she's around and awake, maybe reading her book or chatting to her husband or whatever. And when I visited her today, 3 days after that visit, she said she can't believe the difference. He's so much more comfortable as a newborn. Her milk's come in over the weekend and he's coping so well. And so first of all, when you're on your tummy, the parasympathetic branch of your nervous system is activated. And so it's that rest and digest. Whereas when you're on your back, as Anja was saying, it's quite a vulnerable space. So we're often in a sympathetic fight or flight mode when we're on our backs. So that's not conducive to rest and digest. So first of all, the parasympathetic is activated, and then that whole digestive system has the weight of the body, and the fascia is softened. So those little valves and those and the underdeveloped digestive system that has to now start digesting milk, and that's where we see that babies struggle, is with this. It's so soothed by the weight of the body and the softness. So you just really can see the tangible results when you give mothers permission to do it. And then, as Anja said, from that position, from newborn, babies will already start to do these movements. They're not necessarily moving forward, but they're lifting a leg, lifting an arm. And then by a couple of weeks, months old, that's when you see that typical position where babies are sleeping with their knees curled up under them and their little bums in the air, that gorgeous sleeping position. That's so important for brain development. And in our practice, unfortunately, we see so many 5-6 month old babies that are incredibly tight in extension like this and can't sleep in that position even if they wanted to, because their body is extended. So yes, it is about finding a balance, and it is about understanding, at times, for whatever reason, you might need to put your baby in a container, but then to recognize more than just the 5 minutes of tummy time. It's not, I don't have anything against tummy time and it being called tummy time, obviously, but we shouldn't have such a thing, because it should be a natural development of how we engage with our babies. Sorry, Karen, I see that your hand is up and I missed it.
I just wanted to add to that, because I also agree with it so much, and I see the difference. And it's always important, and I always think back to when I worked in neonatal ICU, how we would always put the babies on their tummies, and they would have much less apnea when they were lying on their tummies, and they grow better when they're lying on their tummies. And also because of the Moro reflex. So for the moms, the Moro reflex is the startle reflex. If they're on their tummies and they have a startle, which they tend to startle a lot in those first weeks because it is a reflex, so noises and things will start, but they're startling into the bed, so it doesn't necessarily wake them up, as opposed to being on their back when they startle, and it'll wake them up, constantly waking themselves up, and they never have that deep sleep, and then they become cranky.
And that's why we swaddle, right? We swaddle so that they startle.
Don't have the startle, exactly.
But, well, the startle is an important reflex that needs to be integrated,
Yes.
but it can be done more comfortably on their tummy, whereas now we swaddle, and now we're tightening the shoulder girdle, we're tightening all of this fascia around the pectoral, and it's resulting in these babies who just don't have range of movement. Yeah.
I think one of the other lovely things about starting to put babies on their tummy from day one is that it will help moms get confident when they see how strong their babies are, that they are able to lift their heads. And even when they do face plant, they will always lift up and turn to the side, and up and turn to the side. And every day you notice how much stronger they get when they move into that little baby cobra and start moving, literally crawling. So yeah,
Karen, that is quite an important point to make, because that is actually the reflex that makes the baby lift the head, and that should be there in a normal birth where everything went right. If that reflex is not there, normally the doctor has picked something up.
yes.
So so when everything, the reflexes are there, the baby is safe on the tummy, because they will, with that reflex, lift the head and go towards the flexed arm, the head will turn. So that's the reflex on the tummy. And it's so awesome that you know about the Moro reflex, like Amy also said it so well. So I treat now all the children, they have nightmares. So I mean, they pass 6 months, 8 months, they wake up with these night terrors, and it's often because they sleep on their backs and they are in that moro reflex, in that fear reflex. And once you put them on the tummy, those nightmares disappear. It's also quite interesting for an older child.
Yeah. Great. Okay, I'm going to mute again.
Yeah, so tummy time is easy, you know, and if a child is used to being on the back, what has worked for me, helping mums to transition, you know, once a baby is so comfortable on the back and they don't have to do, because it is work for a baby to be on the tummy. It is work. And, you know, growing up is work, and developing all the muscles and becoming human is not, it is work. We have to understand that. But if I get a mum where often I get those mums, no, my baby screams all the time on the tummy. What has always worked is if I say, put the baby 10 times a day, 1 minute on the tummy, and then you lift. So spread it out during the day, 1 minute. And I promise you, with every client that I saw, this minute elongated and elongated until they were fully happy on the tummy. So that's quite a nice measure to go about, because if you just tell moms, just put them on the tummy, almost it's like an overwhelm.
But if you start from day one, day one it will be no
need to do that now all the time, but then the baby's screaming and just it's nice.
Yeah, I think Anja's internet is giving issues now, but yeah, exactly as you say, if you start from day one, then you're less likely to need to go through this process of teaching your baby and strength and helping them to strengthen. But we do obviously in our practice encounter older babies who've never had any tummy time, and then we do need to give guidelines to slowly integrate that into your daily routine. But ideally, from day one, you're letting your baby spend time. So it starts off naturally. A tiny newborn sleeps on their mother or their father's chest the first few nights, in my experience. You know, if you're in the hospital, I always as a doula, I guide my clients to rather keep their baby skin to skin on their chest rather than in the bassinet next to the bed for those first few nights if you're in hospital. And if you're home, the baby's sleeping on mom or dad's chest for most of those first few nights. So it starts off naturally. Then they are accustomed to having that tummy time when they sleep on their mom's chest. And then, as I said, during the day, you can, after a feed and a burp, when they're asleep, you can move them onto their tummy next to you on the bed when you're around and aware to watch them. And then slowly but surely it just becomes the norm, and it's never something that has to be taught. That would be the ideal world. Sorry, Anja, we lost you for a minute. So I just picked up.
I know, I don't know where you lost me, but your beautiful face is froze. Okay, I just wanted to, I don't know if you got the thing that worked for me, 10 times a day, 1 minute on the tummy. Yes. I don't know if you got, okay. Okay, cool. Awesome. That's all what I wanted to say.
Okay, great. Yeah, are there any questions? I mean, there's so much to talk about with craniosacral therapy as a whole. I don't know if there are any specific questions.
I don't know if we should explain what cranio actually is, because that's always such a big term. Yes. It sounds so. Yeah, shall we explain that? Shall I get my skull and then? Okay, yeah. I'm sitting now on the floor hoping the internet connection is better here, so please excuse. I'm just getting my skull. Okay, so basically what craniosacral therapy addresses, it's a very light touch therapy that checks the movement of the cranial bones. And if you can see a little bit closely here, these are sutures. Those are almost like joints. And what these bones do, they actually move out very gently and in, all in a symmetrical manner. And as well as the frontal bone and the occipital bone, they would also move out and in, and all the bones move in a symmetrical way. And so we address the movement of the cranial bones as well as the pelvic bones, and we feel for the fascial system that's in between, that surrounds everything. So it's very physiological, it's very anatomical, but it's a gentle light touch, because only with light touch can we assess the craniosacral movements as well as the fascial system. And what is really, really cool, so I've got a little brain here, and deep within the brain, there's basically fluid produced that surrounds the brain tissue and flows down the spinal cord. It cushions the brain and the skull, brings the nutrients and the oxygen. So it nurtures the entire system and also detoxes. So it brings the good and takes the bad. And we want this system to freely flow and function optimally. So there is a wave that's running deep within you. It's really mesmerizing. It's almost like it's got a cycle of 6 seconds and then it goes, it's reabsorbed. So it's quite tangible. And because the fascial system is also fluid filled, there is a ripple effect into the fascial system. So what we can feel is then we feel the body expand and then come back. Almost like a 1, 2, 3, 4, 5, and then it comes back. I'm showing it very fast. Obviously in babies, it's very subtle, and adults show different rhythms as well, depending on the restrictions. But that's what we feel for, and that's where we can feel the restrictions, and we can basically release the cranial bone, the fascial system, and it can go really deeply into cellular level. And as we all know, the body is a memory bank, because when we are in any situations, our brain, our central nervous system gets aroused and we release chemicals, and that gets trapped in the fascial system, and we can release all of that too. And especially babies after birth, I think the sooner a baby receives craniosacral therapy, the better. Dr. Upledger has said that he believes that 50% of brain challenges can be actually avoided with craniosacral therapy and fascial release. So that's quite big. So craniosacral therapy can really be done as soon as possible. And also Amy does this beautiful bath, where I think Amy, in the first 6 weeks, they should come to you to basically unwind, taking the gravity out again, Amy, and then the baby can complete the birth process as well. Okay, so that's Amy, if you want to add something.
Yeah, so I was just going to add that so cranial works then on the physical, on the fascial unwinding and releasing the fascia after birth, if it has been a difficult birth, or even just in any birth, because birth is inherently traumatic in a sense that our body goes through, and the baby's body goes through some duress during the experience. It's even a simple, easy, straightforward birth. The baby's body has still been compressed through the birth canal, navigated the bones of the pelvis, and there is space there to allow that fascia to unwind. Because if we can prevent any tension or torsions being created in the fascia early on, then the system is set up to function optimally. Their blueprint is established and set up. So it works on a fascial, very physical fascial level, and then because it's accessing the nervous system, as Anja was saying, feeding the cranial, the cerebral spinal fluid feeds the nervous system, we can also work on a deeper, more emotional level around down regulating the nervous system. So if there was a lot of stress or anxiety, and very sympathetically driven from the mother's side, because babies and mothers share a nervous system in the early years. Babies don't have fully developed nervous systems yet, so they are regulating themselves off of their mother. So it's so beneficial to treat mothers and babies to help down regulate the nervous system, to activate that parasympathetic, because the parasympathetic space is where the growth and development and thriving is, if that makes sense. Karen, I'm never sure if your hand is still up or up again, so I'm distracted. Sorry.
It's up again.
Oh,
no, it's up again because I know you were showing the sutures and the movements of the cranial bones. And I was wondering if maybe, I think you probably have explained it, but just how the nature of birth is that the cranial bones do tend to, they are squashed together, and that's part of nature, and so that it allows the baby to move through. And then also, as you say, the nature of birth from a midwife perspective is that the baby is moving down, but also constantly rotating. And there's a lot of rotations in the head, in the body, all of that, that requires unwinding, even if it is a smooth birth where they made all the right movements and everything. But there's also other times where sometimes they are in a funny position for an extended period of time, and they literally come out a little bit stiff on one side because of that. And for me personally, I find that regardless of how baby was born, how the labor went, whether it was a smooth birth with no issues, because I never know what's going on inside anyway. I only see the baby with the head crown, so I don't know what was happening up there. I just find that all babies benefit from a session of cranio within the first 6 weeks. And I agree with you, and I love that you do mom and baby, because it's just a beautiful way, as you say, they share that. So yeah, I think that was just from my perspective, and I don't know if you want to add anything to that. I'm just going to put my hand down. Okay.
I'll try and keep my eye on it. No, I don't have anything specific to add, because that's exactly how it is. The body, the baby's body, the bones are molding, as you said, the cranial bones. That's to a degree that's normal. We obviously want to be sure that in the first 24 hours that settles again. And from a cranial perspective, we sometimes see babies who still have ridges 6 weeks or more later, and that's a clear indication that there's tightness in that fascia, in the dural membrane that holds the brain, and we need to help those bones to shift and to help them, to guide them, to hold space for them to shift into their optimal positions. So yeah, it's normal, but it should settle very quickly after birth when there has been a molding. So things that intervene with that, or things that interfere, would be vacuum extraction, baby that's had to be assisted with forceps or vacuum. Sometimes babies who are stuck, like you said, in an asynclitical position, maybe, being really, from the contractions are pushing them against their mother's pelvis, and then they have a cesarean birth. Then those babies can often be really quite tight in a specific position, and we see torticollis where the neck is tight on one side. And in those cases, those babies really benefit from a bucket bath. And I know that you've done the bucket baths in the past as well, Karen, so you know how the baby can go back and can complete their birth journey, because a lot of those babies are sort of stuck halfway through the process. So those reflexes and that sort of unwinding of the rotations haven't been completed. So we can guide the babies in the bucket bath to complete that after birth. So the midwife who taught me the bucket bath, obviously, I mean, she's been doing them for years, for the last 30 years, but it's wonderful to be able to bring my cranial knowledge into that space, and then to often assess a baby beforehand. Is a bath going to be beneficial in this case, or do we need to often I find the bath is a really good place to start with just general fascial unwinding, and then we can see after the bath if there are restrictions or tightnesses that we still need to work on. And one of the things that Anja and I do at our baby clinic is we show the parents simple stretches that they can do at home with their baby to help to mobilize the whole fascial system. So the idea is that, you know, I was saying earlier, we want these squishy babies. Babies should be soft and squishy, but so often nowadays we find our babies are really quite tight and tense, and even from when they're very small, they kind of hold themselves away from you when you hold them. So we want to guide our parents to understand what is normal, how do we want our babies to feel, soft and squishy, and how can we guide that. So there's certain sort of movements and exercises that we show them to help stretch out all of these muscles and these areas in the diaphragm, in the abdominal diaphragm and the respiratory diaphragm and the thoracic diaphragm, that can create tightness and tension that can then result in colic, reflux, all of these complications that we see, breastfeeding complications, latch difficulties, etc., etc. Yeah. Did that explain? Okay.
Yes, absolutely. And I love what you say about babies being soft and squishy. And we can tell so much when you hold a baby what is going on in their body and what's happening with them.
Yeah. So if we can, exactly. So if we can release that fascia as much as possible by the parents doing some of these stretches at home in between cranial sessions, then it allows our cranial sessions to be so much more effective, because the fascia has been released and we're not first working on that, and we can go in and actually work on the system and on the cranial bones and the sacrum and sense into that movement and that flow with having already addressed some of the tightness in the system. So that's why we started the clinic, as a way to empower moms, because you can't be at your craniosacral therapist every single week or at the chiropractor every single week. You know, you want to be able to do something hands-on at home.
Yeah, and those stretches are actually so easy. They're really so easy to learn, and for us, it's important to empower the parent, really, to bring the tools to the parents so that they can do the work. And it's so much fun, you know, it's really so much fun to stretch your baby. And I wanted to say one more thing, because I had 3 cesareans, and obviously that is one of the things that I went quite deeply into. And with my 3rd child, I went to a craniosacral therapist, and she did a full birthing experience for my child. And that was, you know, some births just end up in a Caesar, and but you can get it back. So it was the most beautiful 2.5 hours of her holding my baby in that birth canal, mimicking that. And then from that, he kick-started the reflexes and went through this whole rotation process of going down the birth canal. And then she always says, no, Anja, he's not born yet. He's not born yet. And when his head basically crowned out, she put him on my breast, and it was the most amazing experience. And I found so much healing in that, because I almost failed as a mom. That's how I felt. But with having that experience, it was so healing, and it was as if I birthed my child in that moment. And so that's where craniosacral therapy or any touch therapy can, with that consciousness, can just be so wonderful. So I just wanted to share, because especially in this country, Caesar rates are just so high, and some mothers, like I was, so disempowered. There's always a way. So I just thought I'd bring that to the table.
Did you notice a change in your baby after that session?
Yes, so his cesarean was extremely traumatic. He was just ripped out, and what happens is then, due to the loss of compression, you know, from going from a compressed environment to almost like your skull and your brain tissue gets ripped, gets torn. And obviously the emotional aspect of it, he didn't sleep. He didn't sleep. He was, I think, in a constant sympathetic overdrive. And after working through that birthing process, there was definitely so much more calmness. I worked with homeopathic remedies. I should have gone for craniosacral therapy. But back then I didn't understand why I should go. I think I needed it more, but I took it back later. I went for lots of sessions later on, but that's why I know exactly. Mums always want to give everything to the baby, but mums come actually first. It sounds almost, but you need to be strong, and because the baby, as Amy said, feeds off your nervous system. So when you are strong and healthy and vibrant, the baby feels that and can thrive with that. So I should have gone. So that would be my advice.
Thank you for sharing. That's really, it is beautiful, valuable advice, and it's lovely to get it from you having experienced it.
Yeah. Thank you.
Cara and Jacqueline, do you have any questions for Anja or Amy? And is there anything that you want to share just from what you've listened to and heard this evening?
Sure. This is the first time I've ever been introduced to this, and I didn't know what it was about. I thought, oh, let me just join and see what it's about. So it's actually been quite eye-opening, because I didn't even know that this was a treatment or a therapy or anything like that. So it's been really interesting how, I suppose, birth affects, well, it does, affects you and baby, obviously. But I mean, I didn't know like the swaddling and the chairs and stuff like that was so restrictive for the child. And like you're forcing them to do something their body hasn't gotten to yet. I thought that was quite interesting, because you think you're doing the right thing because other people have done it, sort of thing. Putting them on their tummy, it seems, it's like I'm torn there. Like it seems like it's the right thing to do, but at the same time, it's the fear of, if you put them on their tummy, what if something happens, you know? But the bum in the air, sleeping and all of that, that's what I see in my mind with the baby, which then confuses me with the swaddling, because the swaddling is supposed to be, you're saying it's restrictive, but the information you read is about keeping them close to like themselves so that they're okay. So it is confusing, that exactly what you guys said in the beginning. You get one bit of information and then you get another. So which one is it? Which one are you supposed to do?
Tummy sleeping. Tummy time.
Hey? Tummy
Tummy
time.
sleeping.
Okay.
Yeah.
But then
there's really great research out there to guide you, and to get just, I think the idea is just to approach, is this your first baby?
Yeah.
Yeah, to just approach it with an open heart and with this knowledge, and just feel into it, you know, because you'll be guided by your baby. And as we said, if you start with just short times during the day, putting them down on their tummy and seeing for yourself how strong they are from the beginning, and how instinctive and natural it is for them to be in that position. And as Anja said, there's I've lost it now, but oh yes, you just need the floor, you know. And there's this wonderful Instagram profile called On Track Baby, and they talk a lot about these milestones and using just the floor. And it's incredible because it just frees you up, because if your baby is accustomed to lying on their tummy from a newborn, as they get older, if you're cooking in the kitchen, you can just put them down on the floor where you can see them over there in the lounge, or you're just on the other side of the counter, and it just frees them up to explore and to be exposed to the environment. And then from that position on the floor, they push up and then they push back into sitting when they're ready. And it's none of this wedging and containing and forcing. It's just allowing the natural development of their system. So let your baby guide you, but just approach it from a really open-hearted, inquisitive space rather than a fear-based space. I think we approach
Yeah.
so much mothering from a
With the
place
fear.
of fear, and we
Yeah.
should actually be making our choices from a place of love and curiosity and trusting our babies. We really want to trust our babies, that they know how to grow and they know what they need. In the same way that we trust our baby during birth, you know, we can't tell him or her when to rotate, when to release their shoulder. We trust that that's an inherent part of their process. We're now learning to trust that if we put our babies close to on our chest or on our stomachs, they will find their way to the breast. They'll do the breast crawl and find their way to the nipple. It's an extension of that. We've been so disconnected from our true essence and disconnected from our children. We don't trust them anymore. We need all this external information and advice and paraphernalia to do it for us. But we can actually let them guide us from the beginning in that way, because it's just the instinctual, natural steps that they take.
But they can only guide us if we give them the opportunity of it.
Give them the space. Yeah.
So I'm just saying that again, and I know I'm a bit more strict. Amy just puts it always so beautifully. I just know how much hard work it is to go down onto the floor with an 8-year-old who still has to catch up on those milestones. It's hard work. So if you can do it from the beginning, it's so much easier. And I've crept and crawled myself for kilometers. So just to be able to organize brains. So that's why I'm so adamant, you know, a baby's natural development is God-given. And you as a mom, you know what feels right for your baby, and always go with that. You are the expert in your child because you've got that connection. So trust that. And I always say the more natural, the better.
The simpler, the better.
Yeah, the simpler. I mean, we complicate everything.
Stuff,
and to be honest, it's also a money-making business out there. Everything is, we have to be a little bit more discerning and then choose wisely. I can just.
Yeah, and there might be, you know, if you look at the swaddling, you know, ultimately we want our babies to be sleeping skin to skin, close to us, co-sleeping with us. That's the best for their regulation and development. So we don't really need to swaddle them when they're in that environment. But if your baby's used to sleeping close to you and next to you and feeling the warmth from you, but then for some reason you need them to sleep on their own, then maybe a light swaddle is going to help them feel safer for that particular nap at that time, you know, or once, you know, it's I guess the idea is just moderation, and to use things with an understanding and conscious awareness of why we're using that. You know, we always say swaddling makes them feel safe, like in the womb, but actually in the womb, babies are moving around all over the place, you know. So it's just about adjusting these things and using them in a way that works for your space, your routine, and your mothering.
But that's so funny, Amy. Thank you for bringing that up. You know, if you just think about it, babies are in a fluid environment in the tummy, and they are really moving. And if you just check your baby and you don't feel your baby for some time, you get worried. Yes, I mean that's the case. So a baby is meant to move, but once they come out, we restrict them. It's like, what has happened? So that's exactly it. They want to move and they're made to move, and that's where they actually. And when a baby expresses itself, we always think it's the negative cry, but that's the only form of expression they have. So you will learn to know exactly when it's a cry for communication or when it's a cry of despair, and now you need to come in, mom, and just assist me. So just watch for that. We often rescue too early, and then we tell basically unconsciously the baby that movement is hard. So that is one advice that I can give you. Also in my sessions, if I have a new mom there, I said, are you okay with the baby communicating with me a little bit? Which is and then I guide her through that. And so just remember that they express through through a cry. No, Amy, would you?
Yeah, that
you
is
agree
their
that?
communication is sound. Different types of sound, and not wanting to stop it or fix it or whatever, but rather listening to it and hearing what they're saying to you and how they're saying it. So it's
you've got your needs. Sorry.
Yeah. I was going to say I'd love to make a little quirky comment actually, because I'm really enjoying you guys. Karen, when she asked you to talk about the sutures and the skull, she probably knew that that's the thing that craniosacral people find really hard to put into words. I thought you guys did an amazing job, because it is so fluid, and it's, I know for new people just hearing it the first time, it might sound a little bit freaky or something, or a bit strange, but it's the most beautiful thing. And I just wondered if you guys, I just was thinking as you were speaking about the absolute beauty of working, say, with pregnant mothers. And I've done a little bit of work around, mothers reflecting on how their birth was, and as we've got these two beautiful, soon to be people holding their little ones. I just wondered how that would sound to you guys, this idea of actually, we've been babies too, so we have birthed. I find that such a tremendous piece of information for my body to know, wow, actually, I don't know exactly how the birth is going to be, but I know it in my body somehow, and to heal those parts that might have been interrupted. I was born C-section. I've had to do a lot of recovery around that for me personally. So right the way down to pushing myself out of bed in the morning sometimes, to feel like sometimes I just want to stay. I want someone to do it for me, So even knowing that in my body was really important when I came to birth. Do you know what I mean? I don't know if you've worked with adults in that way as well, because I just think for soon to be moms, I mean, you're moms right now, but just knowing that, so maybe I will meet a little kind of a border in the birth process, but I can move with my body through that. Do you know what I'm saying? Does that might be
the birthing reflex is so powerful, Sarah, what you're talking about.
Yes.
And if we hold an adult in the fetal position, and then you work with this reflex of the birth reflex, where you hold on the head and the feet, and then they start pushing. And some adults cannot find this reflex of going into that extension. Is so interesting. I was also Caesar baby, and I know what you mean by just staying in bed.
Yeah, it's fun.
And retraining that pathway that you can get out there without the help. I know what you mean. It's very powerful.
It is.
So you see the emotional layers that are in the in our body consciousness fascial web. It's quite.
There's so many layers. I mean, we did some of that rebirth work during our training. Each of the students got to go through that rebirth process with the facilitator and the other students holding space for them. It was incredibly powerful, and it's not something that I've explored since with my clients, although I do work a lot with pregnant women, and I find that all my sessions have a sense of womb space and a sense of embryology, and you can't move away from that. But I know from my experience of the rebirth how incredibly powerful it is. So I do think it could go a long way to healing trauma that might exist from your own birth. So I've recently had clients who have had to work on releasing that in preparation for birthing their child, to release what they experienced in their birth, or maybe what they don't remember experiencing, but what their mother remembers experiencing, and how that has sort of formed them, informed them.
And I just had a question there. Is the time there, Karen, for a quick question?
Yeah, sure. I think let's give it another 5 minutes.
Oh yeah. No, I just wanted to know, and I picked this up from somewhere, but in terms of the sort of the movements and stuff like that, Anja, so, or either of you, I just wondered, like, how much rehearsal is there going on in the womb? Like, we've got these two gorgeous pregnant women with us tonight, and I'm just wondering in what way are the babies kind of doing these gestures, even in utero, like, or is it more like at the birth that they do these movements that they will be then doing in that first year kind of thing?
No, it starts in the womb, no, Amy, definitely. So the ATNR, so it's when a head turns to the elongated side as well as to the flexed side. So there's lots of cross-lateral movement happening already, and all the reflexes of touch, smell, all those reflexes are ignited already in the womb space, in utero, definitely. Utero is amazing, and it's in that fluidity that it can unfold so beautifully. So there the process just happens, isn't it? In utero it just happens. And then ideally through the birth canal the reflexes start to propel the baby downwards, and then from there it goes, and it should just continue and not be inhibited by us interfering. I do believe we interfere all the time, but it's a fine balance. How much do we interfere and how much do we actually guide instead of interfering? And I see that in my raising my children. How much do we need to guide? There you go. We have to find a balance, isn't it? And maybe overthinking it is not the way. We just have to go with the flow and then just feel into the rhythms and go with it.
If I can just add something to the reflexes, where you're talking about the baby's reflexive movements, and then there's also the fetal ejection reflex, which is, coming from the mother. So both of those reflexes working together in harmony, when it all comes together beautifully, and when there is an ability to release resistance and to release tension, and without unnecessary outside intervention, then those reflexes are able to work together and allow the baby to descend, to rotate, for the mom's, for the fetal ejection reflex to guide and push the baby with that downward pressure. So yeah, beautiful when we trust nature.
Exactly.
So incredible.
Anja and Amy, I want to thank you both. I don't want to keep you much longer. We've already gone on a little bit longer than I said it would be. And I really do appreciate you coming in this evening and chatting to us and just sharing your expertise, your wisdom, your experiences, and just, also, you remember what you mean about the clinic? That sounds lovely. I can also chat to you about that, Sarah, because I also do those baths. So it's beautiful.
Yeah, I was saying I'd love to see a video of this bath thing. It sounds wonderful.
It's where you hold the head, right? And they're in the bucket. And then they just turn and things like that, right?
Yeah. It allows them to do the rotation movements. It's
okay. Yeah, I've also seen that. It's very cool.
So yes, thank you so much. And Amy Anja, I can send you a link as well, or Amy, you can share the link. So both Amy and Anja are in the Due Date Club if Jacqueline and Cara or anybody has any questions about that, or you want to reach out and ask something. And then Amy, if you can just maybe make sure that you provide a link to your services, to your clinic, everything. So if anybody does want to reach out to either of you or both of you, that they can do that as well. Okay.
I'll send the details to Anja to log in, and then I might have to ask you where and how to share, but I'll figure it out.
Okay,
I'm sure. But yeah, we'll share those details. I don't know if anyone's in Cape Town. We are going to be having one in Cape Town in the next 2 weeks. And then we'll
clinic.
Yeah.
Okay, fantastic. Oh, coming all the way from Somerset West.
All the way.
Where are you going to be doing it?
We haven't 100% confirmed, but it'll be southern suburbs.
Okay, fantastic. Super. Let me know.
Will do. Yeah. Thanks so much, Karen.
Thank you.
Thank you, Karen. Thank you, Sarah.
Thank you so much.
Great.
Thank you.
Thanks, Sarah.
Wonderful.
Bye.
Great to connect.
Bye-bye.
Lovely.
Thanks. Bye.
Okay.
Sarah.
Bye-bye.
Bye bye.